Do you know that the second leading cause of death worldwide is something that we can often prevent? It's a shocking fact, but it's true. I'm talking about strokes. Today we're going to be talking about this silent killer and how you can recognize its warning signs. The reason why we need to talk about strokes is that they are incredibly common, and yet so many people are unaware of the signs and symptoms. Strokes don't discriminate. They can happen to anyone at any time. What's even more alarming is that strokes are often a result of factors within our control, like diet and lifestyle. So, what exactly is a stroke? A stroke occurs when the blood supply to part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. This can be caused by a blood clot blocking a blood vessel in your brain, or by cholesterol plaque causing a disruption in blood flow. In the lead up to a major stroke, some people may experience mini-strokes or transient ischemic attacks, TIAs. These are short-term disruptions in blood flow to the brain which can cause temporary symptoms similar to those of a stroke. Now that we understand what a stroke is and how it happens, let's take a look at the 9 key warning signs that could indicate you're at risk. Persistently elevated blood pressure. Stroke 1 month before high blood pressure is one of the most significant risk factors for stroke. If your blood pressure is consistently above 140/90, this should be a red flag. Persistently high blood pressure can cause damage to your blood vessels, making them more susceptible to clots and blockages, which can ultimately lead to a stroke. It's crucial to monitor your blood pressure regularly, especially if you have a family history of hypertension or other cardiovascular diseases. Understanding the impact of high blood pressure on your overall health is essential. Elevated blood pressure can not only increase your risk of stroke, but also cause damage to other vital organs such as your heart and kidneys. By keeping your blood pressure within a normal range, you significantly reduce your chances of experiencing a stroke. Lifestyle changes such as reducing salt intake, maintaining a healthy diet, engaging in regular physical activity, and managing stress levels are effective ways to control blood pressure. If you notice your blood pressure readings are consistently high, it's important to seek medical advice. Early intervention and appropriate treatment can help manage high blood pressure, thereby reducing the risk of stroke. Furthermore, medications prescribed by your healthcare provider can be vital in maintaining optimal blood pressure levels. Regular checkups and follow-ups with your healthcare provider are crucial in managing and monitoring your condition effectively. Second factor is excessive fatigue. Although fatigue can be caused by numerous factors, unusual or excessive fatigue could indicate that your body isn't getting the oxygen it needs due to reduced blood flow. Then comes vision problems. Sudden trouble seeing in one or both eyes can be a sign of a stroke. This can manifest as blurred vision, blackened vision, or seeing double. Number 4 is sudden severe headaches. A sudden severe headache with no known cause is a strong indicator of a stroke. Number 5 is numbness or weakness in extremities. Sudden numbness or weakness in the face, arm or leg, especially on one side of the body, is another hallmark warning sign. Then comes speech difficulties. Difficulty speaking or understanding speech can be a sign of a stroke. This could include slurred speech or difficulty finding the right words. Number 7 is hallucinations. Visual or auditory hallucinations can be a sign of a stroke, affecting the parts of your brain responsible for your senses. Number 8 is neurological issues. Sudden confusion, trouble understanding, or difficulty walking are signs of neurological issues that could indicate a stroke. And the final factor is loss of coordination. If you suddenly become clumsy or uncoordinated, this could be a warning sign of a stroke. So if you experience any of these symptoms, it's crucial to seek immediate medical attention. To give you an idea of how these symptoms might present themselves, let's take a look at some hypothetical scenarios. Imagine you're reading a book and suddenly the words start to blur and you're seeing double. This could be a sign of vision problems related to a stroke. You're having a conversation with a friend and suddenly you're struggling to find the right words or your speech becomes slurred. This could indicate speech difficulties due to a stroke. Recognizing these symptoms is just the first step in preventing strokes. It's also essential to manage your blood pressure, adopt healthier lifestyle habits like regular exercise and balanced diet, and avoid harmful substances. Regular checkups with your doctor are crucial, especially if you have chronic conditions like diabetes that can increase your risk of stroke. Remember, knowledge is power. The more you know about the signs and symptoms of a stroke, the better prepared you'll be to act quickly should one occur. So stay informed and proactive. Before we wrap up this video, don't forget to subscribe to our channel for more health-related information and updates. Together, we can make strides towards a healthier future. And remember, if you experience any of these symptoms, seek medical help immediately. A stroke is a medical emergency and every second counts.